Hello, I am Shakti Suprayukti, MSc Tutor of Sri Sri College of Nursing in Sri Sri University. Today I discuss ancient topic role and responsibility of a nurse in medical and surgical setting. Firstly, to know about the learning objectives. In learning objectives, after the sixth session, you will be able to know about the list of the objectives of a nurse in medical and surgical care setting and describe the role and responsibility of a nurse in and providing the holistic patient care and explain the nursing responsibility of patient care in medical and surgical setting. Then lastly, to recognize the importance of a nurses in medical and surgical setting. Then firstly, to know about the introduction. So nurses play a central and indispensable role in medical and surgical setting, then providing the comprehensive and continuous care up to the patient throughout their illness and recovery. The work closely with the physician and also assist with the other healthcare professionals to assess the patient needs, then plan and implement care and evaluate the outcomes. In medical setting and medical unit, nurse focus the management of the chronic illness and administration of the medication, then monitoring the vital signs and educate the patient and family members, in where we provide the health education to the patients and their family members. Then in surgical unit, the responsibility of a pre-operative preparation and intraoperative preparation and post-operative care to the patient safety and promote the healing. Then through the skilled care, effective communication and ethical and legal standards, then nurses contribute to improve the patient's outcome and quality health care of the delivery and also to improve the health qualities of life of the patient. Then to know about the objectives. In objectives, to understand the role of the nursing in the medical setting and responsibility of nurses in medical setting and role of nurses in the surgical setting and responsibility of nurses in surgical setting. Then highlights mainly the pre-operative and post-operative nursing care, then to emphasize the patient safety and quality care. Then what are the role of nurse in medical setting? In medical setting, the responsibility role of the nurse is to assessment of the patient education, then monitor the vital sign and symptom, then administration of the medication according to the doctor's prescription, then assisting the diagnostic procedure what doctor prescribed, then providing the patient education to the patient and prompting the comfort and early recovery. Then what are the responsibility of nurse in medical setting? So to maintain the accurate patient record, but don't write the false record, to take the proper accurate patient record, then observe and report the changes in the patient condition, what patient condition to change, that one we observe, then ensure the medication safety and prevent the any complication are present, then that one prevent, then maintain the infection control practice, then provide the emotional support and patient and the family member. Then what are the role? Already discussed about the role and responsibility in the medical setting. Then to know about the role and responsibility in the surgical setting. Firstly, what are the role of nurse in surgical setting? First one is prepare the patient physically and psychologically for the surgery. Before surgery, patient to prepare the physical and psychologically. Then assist the surgeon during the procedure, when procedure occurs, then to assist the surgeon, then maintain the sterile environment always, then monitor patient during the peri-operative period. What are the peri-operative period? Peri-operative period is all pre-operative, intraoperative and post-operative period. Then ensure the patient safety. Then what are the firstly to know about the pre-operative nursing responsibility. In pre-operative nursing responsibilities, before the surgery or before the intraoperative period. In pre-operative, to complete the physical and psychological assessment, then to obtain the inform the consent, then prepare the surgical site before the surgery, then ensure the NPO is nil for oral status, then administer the pre-operative medication, what are doctor prescribed, then educate the patient about the procedure, what procedure is going on, firstly to educate the patient. In intraoperative nursing responsibility, during the surgery period, what are the nursing responsibility this period? Then firstly to maintain the aseptic technique, always to maintain the aseptic technique. Why? Because of to prevent the infection. Then assist the surgeon team or surgical team, then monitor the vital sign, it is most important during the surgery. Then count the instruments and also to maintain the patient's positioning and safety. Then post-operative, after surgery, to provide the post-operative nursing responsibility. In post-operative nursing responsibility, what are? So to monitor the airway, breathing and circulation, then assess the level of consciousness, it is most important in post-operative period. Then manage the pain and monitor the surgical wound, then prevent the complication in complication like the infection or any bleeding, and encourage the early ambulation. Then infection control responsibility, it is most important in medical and surgical setting. Infection control responsibility is hand hygiene always to, it is most important. Then use to ppe is personal protective equipment, always use this. Then sterilization of the equipment always sterilized. Then safe disposal of the biomedical waste, what waste we collect, that we properly dispose by the biomedical waste. Then prevention of the hospital acquired infection. Hospital acquired infection is otherwise called as nosocomial infection, that one we prevent. Then patient education and communication. In patient education and communication, it is most important in the medical and surgical setting. Firstly to explain the disease condition and treatment, and teach the medication compliance, and educate about the lifestyle of the modification. Then provide the discharge instruction before discharge, to provide the what are the instruction is going on the discharge. Then communicate effectively with the healthcare team. Then ethical and legal responsibility, it is most important for a nurse. What are the ethical and legal responsibility? First, maintain the patient confidentiality, always to maintain the patient's confidentiality, and respect the patient rights, always to respect the patient right. Then follow the hospital policies. What are the hospital policies? Always you follow that because you work in the hospital setting. And then practice with the scope of the nursing, and ensure the inform the consent, always what you would consent to taken before doing any procedure or before doing any surgery, always to take the written consent. And what are the importance is the most important of a nurse in medical and surgical setting. Importance is ensure the patient safety, always to uh, uh, maintain the patient safety. Then improve the recovery outcomes and provide the continuous care, always to provide the patient when patient is always in hospital setting. Then provide the patient care, continuous care. Then reduce any complication is present, always to know what are the complication is going on, if any infection or bleeding occurs. Then to reduce the complication and enhance the patient satisfaction. When to provide the patient care, firstly to check patient is satisfied or not, then always to check the patient's satisfaction. Then to know about the uh, key point. Okay, what are the key point to know about in the what we discuss? Firstly, to know about the introduction of for a nurse in medical and surgical setting. Then what are the objectives? Then what are the role and responsibility for a nurse in medical and surgical setting? What are the role in the medical setting? What are the responsibility in the medical setting? Then what are the role in the surgical setting? In surgical setting, to know about the pre-operative, intraoperative and post-operative period, nurse's responsibility of this period, and also to know about the infection control responsibility. Then patient education and communication. Then ethical and legal responsibility, it is most important. Then lastly to know about the importance of the nurse in the medical and surgical setting. Then lastly, to conclusion of a nurse in medical and surgical setting. So the nurse play the crucial role in the medical and surgical setting. Then their responsibility ensure the holistic, safe and quality patient care. Then effective nursing care leads to better health outcomes. The nurse play the vital role in the medical and surgical setting and serving as a backbone of a patient care. Then through the continuous assessment, accurate medication administration, then skilled preoperative and post-operative care, then strictly infection control practice, nurse ensure the patient safety and prompt recovery. In their responsibility is also extend to the patient education, emotional support, effective conditions and healthcare team by adhering to the ethical, legal and professional standard. Nurse contribute the significantly to improve the health outcome, then reduce the complication, overall the quality of the care in the medical and surgical environment. Then to refer this book. Then lastly, I say thank you.